Sir, good afternoon, sir. Hello, good afternoon, sir.
Yeah, good afternoon, ma'am.
Yeah. Sir, can we start now?
Yeah, ma'am. Sure.
Sir, can you see your students sitting here in this room? Is it visible,
Yeah,
sir?
ma'am. Sure.
Yeah, and the sound is clear, sir?
Absolutely.
Yes, sir. Thank you, sir. Uh, Sir, let me introduce this, sir. This is a Government Ayurved College, Balangir, Odisha, sir. Uh,
Yeah.
we are all the PG scholars here. Here in this institution, sir, two PG departments are there. One it is Sanhita department, Sanhita and Siddhanta. Another is Rogonidan, sir. So all are the PG
Okay.
scholars of both these departments, sir.
Wonderful.
So we are fortunate enough because with us today one of the most eminent faculty of India, Ayurveda, Dr. M. GOPIKRISHNA sir is with us. So students, for your knowledge, sir, I will just give a short introduction because they have to know this thing. So sir is currently practicing at Srinivas Clinic, Bellary, Karnataka. Also, sir is the co-founder and chairman of Indian Institute of Ayurveda and Rasasastra, which is an e-learning website. And sir has completed his MD in Rasasastra from STM College of Udupi. And sir has worked under the eminent personality, Professor Dr. Siddhinandan Mishra sir. And I think you all people have known him very well. And who is the president awardee person and also the author of the numerous textbooks of Rasa Shastra. नहीं तो बच्चों आप लोगों ने पढ़ा होगा सर का बुक. तो sir is having experience in all types of Ayurvedic preparation like Potoli Kalpana, Kupi Pakwa, Parpati, Khalavya Rasayan, Asa Barishta preparation, Tailas, Buttis, Lepers, etc. And also in modern pharmaceutics and metallurgy with practical approach. And one of the most interesting thing about sir that is sir has translated some books like as sir has assisted Professor Siddhinandan Mishra sir in translating Ananda Kanda text that is from Sanskrit to Hindi version. And also Rasa Ratnakara from Talapatra Pothis in Telugu version to Sanskrit version. Chikitsa Padhati from Telugu Talapatra version to Sanskrit version. And also that is Bhaishya Ratnavali from Sanskrit to Hindi version and which are now widely available. Okay. And sir has publications that is more than 20 publications in different peer-reviewed journals. Sir has acted as the guest speaker in more than 1,000 seminars and presentations as the chief speaker. Also, sir has hosted numerous national seminars across India and worked as the organizing secretary. But there is one of the most interesting thing which define the Vaidya. That thing I want to tell you people. This is one of the most encouraging part of sir which I got. That is sir has conducted geological field survey for exploring Ayurveda drugs from different areas and different tribes like forests in Andhra Pradesh, in Sri Salem forest, Mahanandi forest, Nalgonda forest, Devagiri forest, and collected various samples of drugs for Ayurvedic medicine preparation. Also, conversion of mercury in the form of bhasma, metallic conversion, extraction of sattva of copper at 1000 degrees Celsius temperature method. And one interesting thing is that for mineralogical and herbal field survey conducted at Himalayas from Punjab, Rajasthan, Jammu Kashmir part, Himachal Pradesh, Uttarakhand, including Nepal, Tibet, China part of Himalayas also, and also in Europe. So you can think that how much broad vision of collection of this metallurgical part and the drugs sir is having, and collected huge samples as personal mineralogical repository. So with so much of this experience of collection of rock and collection of minerals, and also along with the practice, so I can conclude that sir is a successful clinical person as well as academic person with multi-dimensional views regarding theory and practical approaches in Ayurvedic sciences. With credentials of good successful practice in managing quite complicated cases like cancer, metabolic disorder, lifestyle disorders, and autoimmune diseases. So thank you, sir. You are with us, giving us
Thank you.
time. So let's welcome again, sir. So we are very much happy, sir, that you spare your time, and kindly, sir, you can start your lecture. Thank you, sir.
Sure. Thank you, ma'am. Thank you very much. Yeah. Is it visible?
Yes, sir. Yes, sir. Visual, sir.
Yeah. So, before I start with my presentation, I sincerely thank the whole institute, Government Ayurvedic Medical College, for inviting me for this induction program and letting me to interact with the fresh postgraduate delegates here. So today I'm supposed to speak about something as an introduction for the postgraduates. Salutations to the God for giving this wonderful science of Ayurveda to the humanity and for the development of the science. Before we start with the session today, the very basic thing which I would like to stress upon every student of post graduation is you are being wonderful that you have been selected by the mother nature, and that is the reason why you people are being into this field of Ayurveda. Especially you are doing the post graduation. This is a wonderful thing, a very wise decision what you people have taken, and you have been selected into a particular post graduation department. You are being assigned to do certain works, research protocols, and other things in this particular department. You are representing God He Himself when you are right in front of your patient. Why I say this particular sentence is irrespective of any fields you are. Might be here, as Madam has already introduced, you people are from Roganidana and basic principles. Irrespective of whatever the department of students you interact in future, might be you happen to move to various seminars, you happen to go to visit many of the pharmacies, industries, hospitals, research centers, many of the institutes. There are thousands and thousands of Ayurvedic institutes across the globe, especially here in India. And you happen to go to any of the colleges, you should see any of the department there in the view as if it is clinically oriented, because you are from Roganidana and basic principles or Samhita Siddhanta, either of the departments of these kinds. Once you have done your BMS, means you are already entitled as a doctor. You are a Vaidya basically. Doing post graduation is for upgrading yourself and having a critical analysis of what further, how the research is to be done in a particular protocol. But don't forget that you are basically a clinician. You are supposed to contribute your knowledge, the best part of you, to the science for the humanity, to see that how best you can really establish this wonderful science of Ayurveda to the best possible way. Just because I am in the department of Rasa Shastra, I cannot say like I don't want to treat my patient. We are the people who have stayed branch of Ayurveda. We are introduced this knowledge, especially the post graduation. And the very aim, like what you people need to do as of now is whenever you're studying either of the Samhitas, whenever you're studying either of the textbooks, whenever you're seeing your patients, you should feel as if every line you're reading in the textbook is patient oriented. So, by reading this particular chapter, how can it give the benefit to my patient? When I'm trying to understand a particular concept of Ayurveda, how can I treat the patient? Say, for example, both of you will be very well trained in this future for another 2 or 3 years about a very basic phenomenon called as the Samprapti Gatakas, or might be you will be trained well regarding the Kriya Kala like of a concepts, wherein at every stage, what are the stages of the illness? I will like to say you need to frame that Kriya Kala to every disease aspect. Don't just make things theoretical. If you make the subject theoretical, then your knowledge is of no use unless and until you need to practically approach it. You need to apply it on your patient. Try to learn things in a better way. This is the only thing. And don't get dejected that you are from some departments. You are into Ayurveda. That is the thing. Whether you are from Roganidana, you are from Samhita Siddhanta, you are from Rasa Shastra, or you are from Kaya Chikitsa, or you are from Shalya, immaterial. You are into Ayurveda. That's all. Ayurveda deals the whole science as something called as Ashtanga Ayurveda. Every departments or every person while sitting in his clinic has to assess the patient on every grounds. Presently, I have served for almost 22 years into the academics, but still when I sit in my clinic, I always feel that every department is what I need to know. Every department knowledge what I gained is to be implied on our patient. Whenever I see a particular patient, I need to analyze him priorly. Then I need to plan up my treatment protocols, and then ultimately I have to treat my patient. How best is possible? This is my goal. And this should be your goal as such. This should be your goal as such, or else you will never succeed in life. Not just you complete the degree, might be you happen to join some institute, might be you'll join some R&D, might be you join some industry, might be you start up your own clinic, you join with some hospitals, or whatever the fields you have. Your lots of avenues for Ayurveda persons nowadays. Lots and lots of avenues. So many other branches are also or adopt Ayurveda for their companies or any of the formats. So you can definitely go there, do whatever the profession you have. But one thing, you should open your clinics. Whether you get one patient per day or you get two patients per day, it's a material. You should open up your clinics and try to see that you maintain your clinical protocols right from the day one. Once you finish your post graduation, sit in a clinic. Don't expect you will have hundreds of patients on the day one. It might take some time, it might take some few months, or might be some years. Confidence in you, and then he comes to you for some. And once you start treat them successfully, then there is no one to hold you back. You need to go through this particular science, understand it. Now it's a beautiful time, this 3 years. Try to critically analyze based on your department knowledge. You have wonderful staff. They will definitely help you out in understanding the subject proper in a better way, and you can take the doubts. Don't just keep the doubts within you. Instead, you go and ask those doubts to your teachers. Try to see that your doubts are being cleared at the earliest so that you can study further. And this is how you can definitely make the real value of what you and your department is about plays an important role. To understand this particular thing, when I had completed my BMS, I had an opportunity to set myself into Department of Kaya Chikitsa, Department of Shalya, and Department of Rasa Shastra. I had a seat in either of these three departments. My choice was choosing Rasa Shastra. This was one such subject wherein I thought of is the need of the hour, where I need to treat the patient based on the knowledge of Rasa Shastra so that I can make more and more miracles to my patient. Basically, even though I was an academician, recently I have withdrawn from recent 1 or 2 years. I'm just a clinician now, but it's a real pleasure because when you save a patient's life and the patient comes to you and says, "Thank you, doctor, for giving me this rebirth," you feel something like you have become a parent once again. You find yourself so happy enough that you have given birth to a person, and this is a miraculous science. You are into Ayurveda, nature has selected you to take up this post graduation and make wonders in your life. So don't waste this 3 years. You should not waste even a single moment. Right from the day one, start grabbing the knowledge. Textbooks are readily available. We did not had so many wide range of textbooks when we were doing our post graduation. We did not had so many windows of understanding it. We did not had even proper computer to Google things or know things about. But you people are so much honed enough that you have so much of wide approach. You can understand the subject in a better way. You can interact with far of people. And I'll say this is one such time. Try to register as possible, as many webinars as possible. Because of the reason, any person who comes on the stage of the tries to put his best presentation. So what is his efforts for 7, 10, 20 years? He's been presented to you in 1 hour. So you are in a bonus that you can understand and try to grab this knowledge within that 1 hour. So you'll come to know the best part of what it is. And this is how you can make need to register for as many seminars. Don't limit yourself that you are from particular department. You should not go to any other seminars other than this department. You are bound to go to any department concerned to Ayurveda. You can definitely attend it and try to see how best you can justify in understanding Ayurveda as is. Anyway, present day syllabus guidelines has been well established, very beautifully designed, and it has been given to you as a protocol like this or the study hours. This is theoretical, practical, and interactive hours. Everything is being explained there. So these particular guidelines are to be very strictly followed so that you can understand the science in a very realistic way. Don't make it in a cinematic presentation. Let it be a realistic by having a practical approachability. Normally what happens when you go for the theory, you totally forget about the practical aspect of it or clinical implication of it. But now it's not like that. The syllabus guidelines is so beautifully designed and so hi-fi, something like you start interacting with the things, and it's in the process of upgrading. So possibly in few more months or very short period, even it will be upgraded for the postgraduates, and you will have a beautiful syllabus pattern which will definitely help you to understand the subject, because they act something like fingerprints. You can take those steps of assessment and you can make yourself one of the best outcome of the postgraduates. Anyway, methods of study, there are many means of understanding or how you can study the subject. Basically, from an academic protocol, wherein you have your teachers, wonderful teachers, to teach you the science subject as it is, and that is how you'll start gaining the knowledge. The second thing is even more important, the social. Social is something like about the media. You have lots of webinars, seminars, interacting with the successful persons, teachers, doctors, institutes, research protocol, scientist, etc., and try to see that you upgrade your knowledge by this social interaction, and ultimately your personal interest and academic success proves that how well you can mix up all these three things as your academic development, social development, and personality development in understanding Ayurveda, and that will definitely make you more and more successful. So basically, I'll just run through initial some 7 or 8 slides, which is very much into how you have to study. Just because of the reason you people have completed your undergraduation and landed up into the post graduation, the only difference what we find. See, even in undergraduation, it happens something like you have studied the same Charaka Samhita, Sushruta Samhita, Ashtanga as an outstretch. Of course, you have so many departments, but basically it's the same textbook what you have studied. And even in the post graduation, you'll be studying the same textbooks. Again, it is the same Charaka Samhita, Sushruta Samhita, and Ashtanga. Might be you have a little bit of other textbooks as the reference guidelines, but the only difference between the undergraduation and the post graduation is in the post graduation you try to cross question yourself, why this, have a critical analysis of the subject, try to understand the subject in a very practical approachability. There are many doubts which were not been clear to you in undergraduation. You have just memorized the things and had been to this particular level. But in the post graduation, it happens like you study among yourself, you upgrade yourself, and try to critically analyze the textbooks and try to see that how best you can imply it to the patient's benefit. The very first step how you have to study is determine what dominant style of learning is suitable for you, and according to that you need to go for it. So normally happens some people are happy in understanding or making it in a diagrammatic presentation, graph presentation, pie charts. Some people are happy in just making some Sanskrit shlokas, some lots of theory work, something into form of a designing. There are many things, so whenever you have any of the things of those kinds where you set in, you try to design your subject, your syllabus in that particular dominant style of learning, and then you need to make it to the best possible way. That is really admirable, and based on that you can definitely make miraculous movements. List out all the studying goals and place them in front of you for encouragement. Normally it happens, like when I started my post graduation, even though I was from the department of Rasashastra, it was something like early morning, might be it's around 5:30. I used to just go and work in Panchakarma department, mixing up all this Pasti Dravyas, Abhihangam, Kailas, attend the patients, go for the therapies or the treatments in Panchakarma. Whenever we had good operation theater procedures to go with, we used to attend them almost by 6:37. The OT used to begin. We used to go to the OT, then later have rounds in the hospital. Then after that, run to the pharmacy. Then throughout the day is involved, and by the evening again come to the hospital, go for the rounds, try to interact with the respective doctors to see how best it can do, and evening again go and have discussion with the teachers. And later on in the evening we used to go to the PhD centers at Manipal, where the labs are open for almost 9 to 12. So till 12 o'clock, we used to work in the research labs. Then later on, go home, sleep. Morning, come back to college again by 5 o'clock. This was almost a routine protocol for nearly 3 years. So it has absolutely, we never used to find time, like where what we have to make a margin or how we can go. As the things, when you have a particular patient in front of you, try to read in every aspect. Read it on the grounds of Komarabhrutya, read it on the grounds of geriatrics, gynec and obstetrics, Dravya Guna, Rasa Shastra, Roga Nidana, what Samhita Siddhanta speaks about it, what is Kaichikitsa part of it, what is Shalya part of it, and try to see the best possible knowledge, what is feasible to that particular patient, and try to improve his improvements or the clinical protocol. You need to keep up all these things in your view, keep all these goals in front of you, all these books with you, because you are from Roga Nidana or from Samhita Siddhanta. It doesn't mean that you're not supposed to have a Rasa Shastra textbook with you. You have already accomplished all those things. You have every right to understand every part of Ayurveda. So you need to master everywhere in Ayurveda, because when you have a patient right in front of you, it's not like a contemporary sciences. When we are in our clinical practice, I have so many times, I have patients from the pediatric group, I have gynec and obstetric patients, I have geriatric patients, I have the patients related to Kai Chikitsa. We discuss cases. We are having a huge protocol of successful clinically treated patients. But sometimes it happens, we cannot, usually, we don't refer. Say, for example, it's a patient suffering from some jwara. You cannot ask him, you go to some Kai Chikitsa person. No, we treat them with Amrutarishta. We treat them with Mrutyunjaya Rasa. We treat them with Tribhuvana Kirti. So we have our own protocols. We try to treat the patient. So it's not like when you are in the clinic, your patient should come only from a particular department. He can come with anything. All departments are to be interfaced among each other, so that you have a successful clinical stories to tell about to your students or colleagues in future. So specify your study time for each day of the week. Try to see that you maintain this time protocol. I'll say at least 1.5 hour per day. You should read textbooks. You should read textbook. The rest, everything is for your practice, practicals, etc. And post graduation, I'm really sorry for the students who have come here to do मौज मस्ती. नो, ये मौज मस्ती करने का टाइम तो हो गया है. अभी सिर्फ आपका काम है पढ़ना है, पढ़ना है और पढ़ना है. कितना बेहतर आप अपना पेशेंट को हील कर पाएंगे, उतना ही बेहतर आप होंगे. और बाद में जब आप क्लिनिक में बैठेंगे, इतना एक्सपोजर आपको बिल्कुल नहीं मिलेगा. आप जब कॉलेज में हो, इतना बड़ा इंटरेक्शन होता है अपने टीचर के साथ, कोलिग्स के साथ, स्टाफ के साथ. इतना इंटरेक्शन आपको क्लिनिक में जाने के बाद शायद नहीं हो सकता है. इसके बेहतर है कि आप अभी से प्रोटोकॉल स्टार्ट करिए. अपना जो ट्रीटमेंट प्लान अप है, थोड़ा प्रैक्टिकली इम्प्लाई करते जाइएगा. और जो भी आपको सीखना है, थियोरेटिकल है, टेक्स्ट बुक है, प्रैक्टिकल इम्प्लीकेशन है, कुछ मेडिसिन बनाना है आपको, जो भी है, हर एक डिपार्टमेंट आपको feasible है. So you can definitely learn things in a better way, fix up what they are, read that particular textbook and try to be more specific. Structuring study time, it's very important. You need to cross question yourself. You have studied some few chapters of Charaka Samhita, you need to recollect it again and again, or else you'll forget. You have done some certain practicals, you have done some workshop, you have done some hands-on training. You need to do it now and then, now and then. This is the reason I'll say the best part is go attend seminars. There are lots of good seminars happening all around India nowadays. Try to meet people, try to interact with them, try to see that how best knowledge you can gain from them. Have a structuring study. You need to keep yourself mottoed. Like before I complete my first year post graduation, I should be master in my department. The second and third year is total practical. I'll give time for theory, but lesser time. Maximum time is for my practical approach. How best I can imply it to my patient or in my department. Organize a comfortable place for studying. This is also quite important. You cannot make it yourself study in mid of some garden or hospital lounge or anything. You need a comfortable place so that you can have good concentration on your books, studies and other materials. Take a detailed notes of the lectures or lessons which happens in the college. So it was something like when we were there, possibly we have completed around 100 notebooks of 200 pages by the time we completed our post-graduation. Because so much of notes was being thought or so much was being discussed by the various staff, which was being documented. So even you can do the same thing. That will be a great help, I'll say. Because teacher is so experienced in that particular field that whatever he says is a very strong, commendable thought process. You need to make a notes of whatever the lecture speaks about. If not in the class, later on, once you go home, make a lesson or make a notes of it so that it will be very good guidelines for you for your future. Team up with diligent students. So here I would like to give you in two different phases. सबसे इम्पोर्टेंट है जो भी वो शार्प स्टूडेंट्स है उसके साथ आप हमेशा मिलते रहना, थोड़ा आप टीम अप करते रहना ताकि आप भी थोड़ा अपग्रेड होते जाएंगे. दूसरी बात यह है कि अलग अलग डिपार्टमेंट के लोगों के साथ भी आपको इंटरेक्ट होना पड़ेगा. मैं बोलता हूँ हमेशा जब मैं पोस्ट ग्रेजुएशन कर रहा था, we used to always have an interaction with other departments. You know, it was a healthy discussion. Somebody will say some herbal drug is good in this particular patient. We used to say no, minerals and metals are good. Some other person from Kai Chikitsa, he tells no, the textbook speaks about this particular formulation. And a person from Roganidana or some other departments will say, how do you diagnose a particular disease? What are the investigations to be done there? So there are multiple angles of understanding a disease. So when you mix with various department colleagues, with the diligent students, then you come to know the different phases of the disease so that you will not leave even a single point when you have a patient right in front of you, and you'll team up yourself even in your future clinical practice. So remember the useful tips to get the most out of the studying. Studying is only 1%, 99% of your efforts should be practical approach. How do you critically analyze it, practically implement, approachability, everything. And the most important thing, have enough sleep. Normally people don't have sleep. Daytime they just spend with mobile, WhatsApp, roam around friends, etc. In the night they spoil their sleep and start studying. So you are the students from post graduation, you know better what are the hazards, what happens because of lack of sleeping. So you should know the things better. So instead you sleep very well and try to see that how best you can understand the science, so that you need to protect your health also along with understanding the science. So track if your studying techniques are working successfully. Normally, it used to happen whatever we interact with the staff or with the other colleagues from the other departments, try to implement with the clinical data and try to see that you give it to the patient or practically discuss about it or observe it in a particular patient and try to see how best it can happen. So this is all is a practical studying, you know, how do you practically study things, have your own innovative styles of understanding the science. The most important part is you should have lots of dedication, a passion. You should be something like वो तो पागल है, तो ऐसा होना चाहिए डिपार्टमेंट में, ताकि आप इसके बाद में आप ये मत समझना कि बाद में मैं घर जाने के बाद इसके बारे में मैं सोच लेता हूँ. नहीं, बाद में तो बिल्कुल नहीं होगा. Please listen to me. Nothing will happen once you go outside the college. When you are in the institute, you are really secured. So you need to do lots of trials, ups and downs, whatever is there. But all these things happens only if you have good dedication. So have very good dedication so that you can have wonderful time and try to understand the science in a better way. Try to read papers, articles, presentations, and have a positive thought, what can be done, what can't be done, and try to see that you have more positivity in understanding the science. Never rest, keep moving, and also you need to see that ever you grow. So normally you have to have things like hard work, focus, you need a push, you should have a good goals, improve, serve, perish, and passion. So that these are the success to have a successful life. So without passion, you don't have energy. Without energy, you have nothing. So you should have good energy. So once you have this clinical implication, these are a few of the case presentations I'd like to go. This is a case of a precancerous condition as ulcerative colitis. So if I didn't have proper knowledge about the Sharira Rachana or Kriya, I wouldn't have understood how the organ looks like or how it happens in a normal health. being. I have implied my knowledge from Sharira Rachana and Kriya, try to analyze it with knowledge of Roganidana. What are the investigations? How to diagnose this particular disease? How should I take this? How can I understand a disease like Grahani? How to go with this Rakta Tisara? How to treat the patient? With the knowledge of Kaya Chikitsa, try to go with what all bastis should I plan here? What are oral medication should I give? With the Dravyaguda knowledge, what are herbs useful in such ulcerative colitis? With the knowledge of Rasa Shastra, how can I give various basmas to this particular patient? And try to see with the age group of the patient is a quite a senior person. So you need to know little bit knowledge about the geriatrics. So with the geriatric knowledge, what is the dosage of medicine I need to fix upon? So understanding all these things, we need to extend a little bit. So we had been innovative. So here, understanding all these factors, we have given the basmas in the form of enema. So here we have given picha basti to this particular patient in the form of enema. We have given pravala garbha potali. So beautifully, the patient responded with this ulcerative colitis, and he had a huge improvement, and his gut was totally normal. This is a colonoscope report almost after treatment. Almost it took a quite long time, but nearly see ulcerative colitis is an autoimmune condition, so treating the patient is really challenging, but we could do. This is only because of the interaction of all the departments. Uh, my specialization is in Rasa Shastra, but I equally adore every department and try to see that ultimate thing is the patient is survived. He is fine because he was having 60 to 70 bloody stools per day, and now the patient is absolutely fine. So these things can happen. So when these things can happen, you are supposed to see how the patient can be betterment by interacting with the proper cells. So this is another case with squamous cell carcinoma. We have applied the Manashiladi Lepa to the patient, Jalapocharana with Shalya, and how the patient improved. This is another case with CS stomach. Folklore research, few of the people in the Western Ghats used to give the eggs of these red ants. So when you are into folklore department, you need to interact how best it can be used. Of course, these are Googled photos, but still it is used in some folklore practice, like the egg of these red ants are being used in treating cancers in some of the folklore departments. So similarly, this is C of the gastrium, how beautifully the patient responded by the treatments. This is the CA or the carcinoma of the pyriform fossa. By local application of Tamragarbha potali, the cancer cells got sloughed off. This is acute myeloid leukemia case, what is generally called as the cancer, the blood cancer like of a thing. And blast cells has come from very huge concentrations here, around 95% to blast cells is zero. The patient is significantly improved. Similarly, this is necrotizing type of cancers of the abdomen who have been treated with haratala and panna and gold-like preparations, swarna preparations. And after 45 days, you can see the report of the patient. Huge improvements, necrosis have been reduced. This is also another case, cardiac case, and also this is a lung carcinoma case. Huge metabolically active lymph nodes involvement, caseating lesions of the lungs. We have treated the patient with Mallagarbha potali, Hemagarbha potali, Sarveshwara Parpati, other drugs of the choice. You can see his reports of the patient after 6 months. All the lesions have disappeared. This is CT thorax. You can see all the lesions have disappeared. So this is how we can show the miracles to the patient. And this is how you become more and more successive in your practice. And absolutely, we are just adopting the diagnostic tools. Every medicine given to these patients were from the knowledge of Ayurveda. So this is another case where you have the multiple lesions in the lungs, and this particular patient is totally out of the illness. This is a case of carcinoma stomach. with metastasis. This is another case with intraventricular bleeding in a brain of a child with 4 days. This is a report huge bleed of in the brain. The size of the hematoma was 9 into 7 and 8 into 4. We have given hemagarbha total in the form of matra basti enema because it's a 4 days old child. Eventually, the size of the hematoma shrunken. No craniotomy was being performed, and you can see the size of the lesion is shrinking, and the child survived. This is also another case with cerebral ischemia. These are the reports of the patient and how he improved. Abragarbha Potali, Hemagarbha Potali was given to this particular patient along with Chandraprabha and Ekangavira. You have wide range of substances like the Chaturvida Rasayana Kalpanas. There are few of the Kalvi Rasayanas, Parpati Kalpana, Kupi Pakwa, and Potali Kalpanas. Either of them can be used based on how best you can understand the patient's condition, treat at various stages of the Samprapti, so various stages of the Kriya Kala as well, analyze it, accordingly you need to treat it. Irrespective of any of the departments, just move ahead. Make yourself some space into the society as a successful doctor. So, this is what I wish for the upcoming students. Lots and lots of things. Because when I was into this particular field, we had huge impact. Whenever we see some success stories among the patients happening right in front of us, irrespective of any departments, we used to appreciate it. After all, we are also Vaidyas. We are almost a replica of Lord Dhanvantari. So let us see how best we can make ourselves to the best possible way and treat the patient's condition to the level possible. So thank you very much for giving me this opportunity. Lots and lots of things to come up across. Uh, we have started ourselves with lots of things here, so shall meet sometimes in future. Thank you very much. Hmm. Hmm. Yeah, yeah, yes, ma'am. Yeah, yes, yes, absolutely. Madam, audio. No, I'm not hearing. That's fine. Yeah, yeah. Now it's audible. Yeah, yeah. Yes. Okay. Okay. Mhm. Yes. Yes. Yeah, sure, ma'am. Definitely. Bilkul. Sure, sure. Definitely, ma'am. Definitely. Thank you. Thank you. Yeah, yeah. Okay.